Joining us in studio today, Dr. Jonathan Tripp from Tripp Family Medicine right here in Twin Falls. Should point out the office is located on Fillmore Street, directly across from the main post office. That's on the north side of town. A very nice part of town, too, as well. First of all, though, welcome back.
Thank you.
We were going to talk a little bit about stress today.
No,
That's an issue I think everyone knows about.
I was going to say I don't think anybody talks about that. In fact, that's a hard question for me to ask a patient. We'll be talking about various symptoms, and I'll ask, well, tell me about stress in your life, and I watch their face, just change. Like, well, of course there's stress in my life, but it's always trying to figure out is there something really kind of pushing in the back of your mind, or really at the front of your mind. Sometimes it's occupying your thoughts and really the physical features of your body that you're not even aware of.
I was reading a story the other day about the famous singer Perry Como,
Oh yeah.
and who was a Pennsylvanian, all right, native Pennsylvanian. That's a nice place. And it said that he was known to be so calm, but one of his friends said you never drove with him. And they said when he was behind the wheel of a car in traffic, he was the most stressed out guy you could ever find out. Or
Wow.
he,
Yeah.
he just had a tremendous, he was just always like upset with somebody ahead of him or making a wrong turn and the like.
No, he what I remember from my parents watching him on TV or even his public persona was he was the laid back guy.
Yeah.
So yeah. So you don't know what's underneath sometimes.
It will. There's a lot of talk that it will shorten your life, though, if you have those stressful moments.
Yeah, we have a lot of things that we're going to talk about different physical manifestations, emotional manifestations, and even metabolic. And what I mean by metabolic is things we can actually see on a blood test or a blood pressure or something that we can physically prove that is there. And so let me just start with a couple of these. In fact, let me just paint a picture. The extreme stress reaction. We call it an anxiety attack or panic attack. And what that typically is the person can be sitting, standing, usually not too involved, uh, and their mind kind of takes a hold of what's going on, and the person will often, think, I wasn't thinking about anything stressful, but their heart starts to race.
Hmm.
Then they feel they have to take kind of a big breath because they're a little feeling like, okay, I got to get a big breath. And then they do that a few more times and they quickly become hyperventilated. And the funny part about hyperventilation is you would think your brain would say, okay, too much oxygen, let's stop this. But the communication back from your brain is, we're still short of oxygen. So then you breathe more and you breathe faster. And the old breathing in a paper bag idea actually works. Now, what it does is decreases how much oxygen you're getting in successive breaths. Whereas if you're breathing regular room air, you continue to push your oxygen in your body up. So that's hyperventilation. And that continues to where the person's heart continues to race. They even get into chest pain. And because of the changes in their bloodstream due to the hyperventilation, they'll get cramping hands, cramping feet, and even to the point where they can't use their extremities. And it's really extreme. I mean, it looks like a combination of a heart attack and a stroke and a seizure all in one. And the end result is, if it's taken to its very most extreme, is the person passes out. And then guess what happens? They wake up and they reset. So your body has a self-preservation mechanism to, even though the rest of you is going in overdrive, it'll shut the whole thing down and say, okay, let's start over. And so nobody dies of a panic attack, but they sure feel like they are. And so that's the extreme. But imagine having some of that adrenaline going in your system at a low level all the time. That has an effect, and we're going to talk about some of those.
I had a friend, I worked with him many, many years ago, and when he was in his 20s, he would have a lot of these attacks, anxiety attacks, and it had unfortunately, it impacted his work performance as well. But by the time he was in his 30s, he didn't seem to have them any longer. It just seemed at some point they went away in his life.
Well, there's a lot of things that do change with time. I will often have people pursue counseling because a lot of it is identifying what really causes you trouble and then finding some tools to deal with that. And then the physical manifestations almost go away or do go away. So, yeah, there's a lot of things that can be a short term issue, a financial crisis, loss of a loved one, things like that, that with some time, things tend to improve. So, I would welcome callers on this. This is not a discussion on panic attacks. We want to talk about more of the common things that show up with stress. And so we talked about the heart racing, even sweating, to hyperventilation, headaches. People often don't have a clue why they get headaches. And yet, especially if they can identify that their headache starts in their neck or the back of their skull and then moves its way forward, that almost always is what's called a tension headache. And so the muscle tension is pulling down on the back of your skull, translates to the front of your head, and you have this headache. But if you identify what's really causing the muscle tension, you'll often find stress is the underlying cause.
We've got more coming up following the break, but before we do that, for people who'd like to contact your office, how do they go about doing that?
Yeah, our phone number is 208 933 4400. And website is trippfamilymedicine.com and Facebook, Tripp Family Medicine.
We've got more with Dr. Jonathan Tripp from Tripp Family Medicine on the way. It's 8:40, 32 right now on Top Story as well with Bill Colley on KLIX and newsradio1310.com. Give us a shout in the next 20 minutes or so if you actually have experience. Well, you all have. I mean,
Everybody's had stress.
We'll acknowledge that.
Yep.
Dr. Jonathan Tripp joining us in the studio on News Radio 1310, KLIX, and newsradio1310.com. And we're talking about stress today. Everybody experiences that. We're talking a little bit about how it also manifests itself. And obviously, different people are going to have different outcomes, and it will show up in different ways. And some people bury it really, really well, even while they're having it.
Yeah.
Isn't that true?
It's called stuffing it. Yep. And
Yeah.
that's one that we should probably talk about. But we also want to get to what do we do about it? So we'll let me go through some physical manifestations. We were talking about headaches and tension headaches. And by the way, one of the greatest things, if you truly identify that you have tension headaches, is one to go after the stress because that's the underlying cause. But I've had people come in and say, I've had a headache for 4 or 5 days straight. They're absolutely sure it's a migraine. I check out their neck, I check out their shoulders, and with a little bit of, it's almost like massage technique. So a massage therapist often will help as well, but within about 3 minutes, I can usually take somebody's headache, cut it in half, or make it go away altogether. So that's just a little push for our office, and one of the tricks I learned even as a third-year medical student that I could help out a lot, even though I was just doing, a rotation with an attending physician. Some of the other stuff, we joke about twitches, a nervous twitch, and that definitely is one that shows up for some people. They, don't have it when they're asleep, but when they wake up and they're consciously doing things and their stress is in the back of their brain, they'll have, they'll twitch their head, they'll have an eye twitch, something that really kind of gets everybody's attention. Um, so twitches are there, they're not just what do you say? They're not just for breakfast anymore. Oh, no,
Yeah,
that's
I can remember a prominent U.S. senator. She's no longer in office, but when she would speak before crowds, one side of her face would twitch like that after she'd say a word. And I used to think that she's uncomfortable in that situation.
Oh, I bet you that's exactly what it was. Um, Numbness and tingling. Some people would complain about their face, their hand, lips in particular, and this sometimes is really a direct result of that hyperventilation again, but sometimes it just shows up and we don't really know why, and then when the stress drops, it disappears. Cold sores. I grew up having cold sores from about age 9. I had the misfortune of having shingles as a 9-year-old, and that's the same virus that cold sores come from. And so, about every 2 months, most of my life growing up, I had a cold sore, and sometimes I'd go from one to the next. And that is more of a relation to physical stressors, but it absolutely can be emotional stressors. So, shingles often is a outcome of a virus that's been in your body since you had chickenpox, and you either physically get worn down or emotionally worn down, and boom, this rash and painful rash shows up, and that's what we call shingles. Weight gain or loss. People handle their stress differently. Some are stress eaters, and some totally avoid eating and will lose weight. A lot of you that want to lose weight say, "How come I can't have that side effect?" Because everybody would be skinny, when they're stressed. But that's for the most of us. I think we tend to eat more when we're stressed, and when things get a little better under control, you're more willing and able to diet and to back off on the things that you look for comfort from. um, TMJ, or temporal mandibular joint pain. So it's right in front of your ear. It's where your jaw hinges. this is often a result of people clenching their teeth or grinding their teeth at night when they're not even aware, but their brain is still working through these anxiety causes of anxiety, and they'll often, not even know they have it, but their jaw will feel fatigued, and then over time they start to get pain, and it feels like ear pain, but it's really right in that jaw joint. And so how do you cure that? Well, we can treat it with ice packs and anti-inflammatories and even do steroid injections into that joint, but the reality is if we can get to the cause, which is usually stress, it goes away.
For a lot of people, when they're dealing with some of these stresses, they look for outside. I can remember there were people I worked with over the years that there were cigarette smokers, and if they got into a stressful moment, they'd quickly pop one into their mouth and light it up, take a long drag, and then exhale slowly, and all of a sudden you just see a complete change in them. Now, that's not the healthiest way to deal with stress, but that's what they were looking to do.
Yeah, and it does work, especially if you're already addicted to nicotine, because adding the nicotine satisfies that comfort that your brain now sees in the form of nicotine. So that is true. That's an easy one for somebody that's a smoker. And no, I would not recommend that as something to start up now. If you
No,
if
not
yeah,
later in life.
yeah, not a good choice. But that's what we do often with chocolate, with Oh, I'll pick some of my favorites, like you give me a turkey dinner, like a Thanksgiving dinner, about any of those foods I would consider comfort foods. It's tough to say that, food isn't one of those, but a lot of times it's also, we find other things. Some people will pull back and kind of hide in their room, and others find that if they go exercise, which I think is an awesome stress reducer, you learn that. You may not want to do that, but if you learn that as a tool, doing some exercise really helps physically reduce your stress and emotionally it changes things. So let me kind of talk about some of the emotional and metabolic, and we'll talk about what to do. So emotionally, I use my dad's phrases. When he said, try to explain your emotions, he said, you got three: mad, sad, and glad. So when we're stressed, most of the time, we're not on the glad side. But there are plenty of people who will put a facade, a front up of, they're happy, almost unusually happy, and yet inside they're kind of dying. They're just really struggling with what's going on. So they put on a good front, so that would be the glad side. Mad, of course, a choice to respond in anger to anything that would frustrate you or offend you is really often a sign of underlying other issues that are stressing you. So the mad side is one to really pay attention to. The sad though is the more obvious one. If you're stressed and it weighs on you, feelings of sadness, moodiness, absolutely play into this. And there's a lot of things that we can do to work out of this. Exercise I've already mentioned, which is probably the easiest one to get to. There are medicines, but there's also other causes. Your thyroid can be low, your vitamin D can be low, and these will cause you to feel a lot more on the moody side. So I don't want to get lost in depression, but these are some of the feelings you get. You get cranky. We talked a little bit about substance or food abuse. But what does this emotional stuff lead to? It leads to strained relationships with your family, your friends, coworkers, employees. You're talking about your friend who it really affected his work performance when he's having anxiety attacks. Well, imagine if you're, the cranky person at work all the time. It'll show up, it'll show up in your performance reports. But if there's an underlying cause that can be identified, your behavior may totally change because you don't have that stress hanging on you. Metabolically, or what I can say from a medical point of view, absolutely blood pressure is influenced by um, anxiety, blood sugars change, and that elevated oxygen or the hyperventilation we talked about. These are things I can show you, prove to you that's what's going on. And so I'll have somebody who says, normally my blood pressure is, I'll make it up, 120 over 80, and now all of a sudden it's 160. What's going on? Well, you showed up at the dentist or the doctor's office and your blood pressure went through the roof. Are you stressed about being there? You bet you are. So that's a temporary stressor. The way you cure that one is you walk out of their office. Your blood pressure goes down.
You just rattle a thought in my mind. It's 8:52. Dr. Jonathan Tripp with us this morning. Better Health with Tripp Family Medicine on KLIX 34 right now. I recall being a kid, and I was not a very stressed kid. I'm still not a very stressful person, but when I would be watching certain football games on TV, and if my team wasn't doing well or they were making a lot of mistakes, I would get pretty worked up. And my dad used to say, "Calm down," even though he was the same way.
Yeah.
And if you're in that sort of situation, you got to get up and walk away sometimes.
Yeah, my grandfather, who was a physician, got to where his heart would race, and he was blind, and he listened to many, many ball games on his radio, and he got to the point where he had to stop listening to the ball games because it'd get his heart racing so much. So, in fact, atrial fibrillation, which is an irregular heartbeat that sometimes races, um, is attributed in some cases, or at least made worse, by being stressed, having anxiety.
And I feel that often. I'm a Washington Nationals fan, for instance, so when I'm watching their ball games, they were always close. It seemed last year. By the time I'd get to about 7.5 innings, it was unbearable for me to sit there in front of the last 2.5 innings. Some days.
Because it was so close.
Right,
Yeah.
right.
Nope. That's a situational anxiety, and like my grandfather figured out, he had to remove himself in spite of his love for listening to those games. Um, what do we do? Okay, we talked about exercise. Let me tell you why exercise works. Exercise, especially if you do it for more than about 20 minutes, you do not have to kill yourself. We're talking about moderate, just make yourself huff and puff a little bit. Your brain introduces new chemicals into your body at that time, and we call them endorphins. They're feel good hormones is what they are. And so that will not only do you feel good while that's happening, but it decreases your stress overall and almost like a drug makes you more able to tolerate whatever's going on in your life. So exercise would be a big one. Sleep is oh so important. And often sleep is interrupted because of stress. So people wake up frequently during the night or have trouble turning their brain off when they go to sleep. These are things that I often will try to treat just to sleep first because if you get several days of good sleep in a row, guess what? Your stress is a lot better or you're able to handle it a lot better. Um, some other things that you can do on your own reduce the stimuli around you, your computer, your cell phone, your TV, your radio, everything. In fact, the recommendation I'd give is take 20 minutes in a day and turn off everything. And people will say, well, I can't do that. Somebody might call. Well, call them back. And if you are just quiet for 20 minutes, you'll find that that is an excellent way just to reduce the stress that's going on around you. And counseling, I'd really recommend whether it's with other family members, professional counselor, even a life coach. And people traditionally turn to their pastor, minister, their bishop. Those are all excellent choices. What you're looking for in counseling is somebody that can give you tools, not just a sympathetic ear. And the tools are how to deal with the stresses you have. And then, if you come to me and we find out that all these aren't working, we can talk about medications that aren't addictive. I have over the counter ones that I use, amino acids, but there's also many prescriptions that we can choose, and usually the ones that I choose are old, tried and true, safe, and not addictive. And, I have people that'll come back and say, wow, I never knew I was as stressed as I was, and now I feel so much better. And I was so afraid to even try that medication, but I'm happy you kind of pushed it on me. So sometimes I am the pusher of medicine if I find the situation deserves it.
For people there's all sorts of like exercises. You pointed out taking breathing in and out of a bag, but there are certain that old line count to 10.
Yeah,
There are
take a breath.
lots of different exercises people can do in these situations.
Yeah, that's a kind of a quick tool when you're upset, whether it's the mad, sad, or glad, whatever your response is. Literally taking a second and counting to 10 gives your, shall we say, your intellectual brain a chance to take over your emotional brain. That's really what it is. So we joke about, take a breath when somebody's really all upset, but the truth is, taking some slow breaths does change your body uh, physical response. So I do think, we talk about Lamaze classes for breathing in pregnancy or in delivering the baby. That's a way to focus and control what's going on. And similarly, under emotional stress, if you can stop and have a technique that just says, hey, let's take a few seconds, let's calm this down, let's take some big breaths, or let's get rid of the stimulus around you, those are all great ways to, reduce stress without getting into medications.
About 40 seconds left. I don't know if you had anything else on this you wanted to recommend as well.
Priorities. That is probably the best thing I can give you for advice. We live in a society that has too many priorities, too many stresses. If we choose which our priorities are, you will find that the other things don't fit in your schedule. But if you stick to your priorities, you will have less stress. And so I'll take this from a very wise man, a quick quote that I had that says, if you put those priorities first, oh, here we go, that all other things fall out in their proper place or drop out of our lives altogether. So that would be my advice. Set your priorities. Don't let your world rule you. You rule your world.
See, the doctor is also a spiritual man too. 8:58. We'll see you or one of your coworkers next week.
Yeah, we have two excellent PAs and a nurse practitioner that's with us part time. All of have been just excellent choices for our clinic, and patients love them. In fact, they're liking them better than me sometimes. So that's a good thing.
Good gang of people.
Yep.
Better Health with Tripp Family Medicine. Hey, coming up, we're going to be talking a little business from the Twin Falls City Council just after the 9 o'clock news, right here on Top Story on News Radio 1310, KLIX, and NewsRadio1310.com.